Ophthalmology in Chinese medicine has had another big input from Western medicine. In ancient China, there were no effective lenses, there were no way of looking at the eye apart from with your eye. You could only look at the outside of it. With the advent of Western medicine and the optical equipment, we can now see right inside the eye, and also with the dissection and so on, we've got a much greater understanding of how the eye works. And this, I would say, has fed into Chinese medicine and has enriched it and enriched the overall view. And I would now like to look at it like from the Western point of view, looking at the Western anatomy and comparing it or seeing how it enriches our Chinese medicine point of view. So I'm going to start at the front of the eye. The front of the eye is the cornea. On the outside of the eye, there's this clear, as it were, almost like plastic hemisphere. And the cornea, it's called cornea because cornea means horn. That's all its etymology. And it is a horny substance, and in that it's somewhat like the nails. And so the analogy you can make is anything which affects the nails will also affect the cornea. And you do see this in clinical practice, that just as the liver relates to the nails, the liver and the spleen, one should say, relate to the nails, so you see the patterns of liver weakness giving rise to corneal erosion, for example. The liver and kidney weak pattern gives rise to corneal erosion. And so whenever you see a corneal problem, you can think really in terms of the liver and or I should say liver and spleen, and look also at the nails at the same time, see how they are doing. So look, for example, if there are cracking nails. I say it relates to the liver, but in the same way that the nails are also connected to the skin, in the sense that if you've got eczema, for example, the eczema can spread to the nails and give a problem there. So also you can have the pattern of nebulae in the cornea. That's to say, like areas of opacity. They are actually dampness accumulating in the cornea itself. So they're nebulae. You can think of them as somewhat similar to eczema. So this dry type of eczema, this dry or flaky or that sort of problem is connected to nebulae. The next thing is what they call the anterior chamber. This is the part of the eye which is in front of the lens, in front of the iris. This is filled with what's called aqueous humor, the watery fluid. And this is continually flowing through. It's secreted in the inner eye on the choroid, which is the inner surface of the eye. It's slowly secreted and slowly floats through the eye, and it comes out actually at the corner of the anterior chamber. There's some very fine network there called a trabeculum, which is like a sieve. A trabeculum means little sieve, and it's actually a drain for the fluids to come out. Now, I mention this because it's of great importance in acute glaucoma, because in certain conditions, the iris, which is there, folds over and blocks this drain. And when the drain's blocked, if the secretion continues inside the eye, then the pressure suddenly builds up to enormous proportions and causes terrible damage and quite sudden blindness to the eye. So that's the acute glaucoma. It's also of significance in chronic glaucoma, like what they call open-angle glaucoma. In this case, in open-angle glaucoma, you don't have the holes blocked up, but it's more like they're clogged. And the reason there's many reasons they're clogged, but one of them is that this aqueous humor, this liquid which is slowly filtering through, a bit like serum you could think of it, is actually too sticky, and so instead of clear watery fluid going through, you've got like a turbulent treacle going through, and so this is the reason why the pressure can build up in the eyes. So that's why the trabeculum in that particular part of the eyes is quite important. The next part is the iris. Now, as we mentioned before, traditionally the iris relates to the liver, and I was taught when I was studying that iritis is connected to liver heat, but in clinical practice it doesn't seem actually to be like that. Iritis is quite unusual, and it usually comes as a further development of another illness. However, the movement of the iris is connected to the liver because it's worked by the iris moves by means of muscles, by two opposing muscles. You've got the muscles contracting it and the muscles expanding it. And so in the sense that the muscles or the tendons, the tensioning force of the muscles connects to the liver, so you could say that the iris and its movement and the speed of its adaptation to light, that connects to the liver. The next part of the eye moving in is the lens. Now the lens itself is perhaps the most inert part of the eye. It is actually living. You might think that it was completely dead and inert, and it does seem to age, gradually age, and once it's aged, it's very difficult to reverse it. But it is actually living, and there are living cells in it. But it does get harder with age, and it really does connect to the kidneys. And the way I think of it, well, I think of it almost like bone, or almost like bone without the calcium in it. If it had calcium in it, then you wouldn't be able to see through it. It wouldn't be clear. So think of it more like bone, like without the calcium, or perhaps the cartilage of joints. And so just in the same way that the cartilage of joints hardens and becomes perhaps slightly less flexible and perhaps more opaque with age, so the lens itself stiffens and hardens with age and gradually becomes opaque, or easily can become opaque. The reason why it becomes opaque in cataracts, from the Western point of view, you get cross-linking, and it's cross-linking of the polymers there in exactly the same way that cross-linking occurs when you boil an egg. So the process which causes a cataract is exactly the same process as heat being applied to an egg. And interestingly enough, it's actually the heat conditions in Chinese medicine, liver heat, for example, or kidney yin deficiency, which can give rise to cataract. In principle, one should be able to reverse cataract. In practice, if there's a slight degree of cataract, it's possible to reverse it, but a very severe cataract are very difficult to reverse. Just in the same way that if you have a very severe rheumatoid arthritis, for example, with very severe malformation of the joints, you can help the pain, but once it's reached a certain stage, it's very difficult to reverse completely. So that's the lens. The lens, the focal length of the lens is changed by the muscles which surround the lens. There's some unusual muscles which actually push when they contract, so they actually push on the lens and change the focal length of it. But that's not the important thing to know from Chinese medicine point of view, or from practical point of view, is that as you get older, the muscles get weaker, and also the lens becomes harder, and so it becomes harder and harder to refocus. The adaptation becomes more difficult, which is why I need spectacles from time to time. Proceeding to the next part of the eye, we've got what's called the posterior chamber, and this is filled also with a fluid, but there's another substance in there called the vitreous, and this is a sort of jelly-like substance. This jelly-like substance is still permeated by the same fluid, because the fluid comes out of the lining, the inner lining of the eye, flows through to the front of the eye. But in the posterior chamber, there's this jelly-like substance which is sort of permeable to the fluids. And this jelly-like substance is attached all the way around. What can happen there? Well, the jelly-like substance is closely related to the spleen, because the spleen, in a way I think of it as like the flesh, you could say. You could think of it like flesh, and it should have a certain tone to it. And when the spleen becomes weak, then the vitreous can become weak, and you get a symptom or a problem known as posterior vitreous detachment, which happens when this jelly-like substance becomes too wobbly, as it were, just in the same way that flesh becomes too wobbly when the spleen is weak. And then we have the back part of the eye, which consists of the retina and the choroid and the macula. This is where the detection of light and images takes place. The retina itself is a fine network of nerves, and so as such it's just like the brain. There's a dye which is in front of it, a purple dye, which actually absorbs light, and when it absorbs light, each photon which is absorbed causes an electron to be emitted. The photon comes in, it strikes this visual purple, which then, by degrading the visual purple, causes it to emit an electron, which is then detected by the nerves themselves. It's a very clever arrangement, because this visual purple is produced at almost the same rate all the time, and that means that if there's no electrons coming in, if there's no light coming in, then the visual purple builds up and builds up and builds up, and you get a thicker and darker layer. And that means that every single photon that comes in can get absorbed. But if there's a lot of light, then the light comes in and it actually bleaches the visual purple, and then only a relatively small number, a small percentage of the photons are actually absorbed and turned into electrons. And this means you've got a sort of automatic gain control actually inside the eye. And this is actually the most sensitive gain control, much more sensitive in fact than the iris of the eye. So that means that in bright light, the layer of purple is very thin, it's only very slightly purple, and so the sensitivity is very low. But in dark light, the purple gradually builds up, and the eye is much more sensitive, which is what you want. This visual purple, that's very strongly connected to the liver. An important component of it is retinol, vitamin A, which interestingly is found in the liver. It's also found in carrots too. The visual purple is a very interesting substance. It's actually composed of 3 dyes with 3 different spectral responses. One is mainly responsive to blue light, and one is mainly responsive to green light, and one is mainly responsive to red light, as can be seen in this accompanying diagram. It's the fact that there are 3 different dyes or 3 different responses accounts for the fact that we have 3 colour vision. We don't have 5 colour vision or 10 colour vision or 2 colour vision, it's 3 colour vision. With those 3 colours, you can make up all the colours that we can experience. When these dyes go slightly out of balance, then you can have problems in colour perception. So you can have some measure of colour blindness, like red-green colour blindness, for example. One of the causes for it is that these 3 dyes are produced in the wrong proportion. And when this happens, there is a possibility of that being cured by Chinese medicine, because if you can restore the proper balance of these three dyes, which interestingly is mainly done through the liver, then there's a possibility of restoring full three-colour vision. So that's the visual purple. The retina, as I said, the retina itself is nerves, and nerves, like the brain and also the peripheral nerves, they're strongly connected to the kidneys. And so you see, just as you see in old age, you can see peripheral nerve degeneration. The equivalent in the eye is macular degeneration, I would say. There's also a very fine network of arteries in the eye, and of course the arteries connect to the heart. The blood connects to the heart. You also may see, you can see hardened arteries, and so people in old age will see hardened arteries and the blood circulation is not so good. You can also see blood leaking out, retinal bleeding. Just as with spontaneous bruising in any other part of the body or leakage of blood, this can be due to heat in the blood or the spleen not holding the blood, or due to blood stasis. And this is the same in eye conditions. The final thing to say concerns the optic disc. The optic disc is a small circular area at the back of the eye, slightly off centre, where all the pipework comes into the eyes. The veins, the arteries, the nerves, all the nourishment comes in and all the signals come out at this point. And this point is actually a weak spot in the eye. It's like the weak point in the perfect sphere of the eye.